Welcome to the Disability Squeeze podcast. I'm your host, Dr. Zach Morris. Today's episode features a keynote address from Mia Ives-Rublee, recorded live at the Disability Squeeze Research Symposium at New York Law School on September 26, 2025. Nearly 500 people registered for this event, and we heard from some of our leading national thinkers and advocates, a clear sign, I think, that this issue is resonating deeply with so many. Without further ado, here is Mia Ives-Rublee.
Let's say that I was 100% thrilled when I cold LinkedIn messaged Mia saying, Mia, I would love if you could join us as a keynote speaker at the Disability Squeeze event as a fan of Mia. And I literally went like this in a coffee shop somewhere in Brooklyn. So let me, without further ado, introduce Mia. Mia Ives-Rublee is the Senior Director for the Disability Justice Initiative at the Center for American Progress, and one of our nation's leading disability policy analysts and advocates. She is also, in my view, among the most influential social workers in the country today. A frequent contributor to national media, she is a well-known voice in Washington and a forceful advocate for the rights of disabled people, immigrants, and other marginalized communities. She may be best known for founding the Women's March Disability Caucus, where she helped organize the original Women's March on Washington in 2017. That march was one of the first large-scale events to feature certified deaf interpreters on stage. Her leadership helped push for greater access to accommodations at progressive events and for more inclusive policy platforms for the disability community. For this work, she was named by Glamour magazine as one of its Women of the Year in 2017. She has since been recognized by She the People as one of 20 women of color in politics to watch, and by the University of North Carolina School of Social Work with its Distinguished Alumni Award. Earlier in her career, Mia worked for 6 years as a vocational counselor with the North Carolina Division of Vocational Rehabilitation Services, helping disabled people secure meaningful employment and connect to the services in their communities. Few people are as likely to understand the disability squeeze from the 10,000-foot policy view of the White House, of the Congress, where Mia is frequently, to the day-to-day realities on the ground. Please join me in warmly welcoming Mia Ives-Rublee to our symposium today.
Thank you so much. Good morning, everybody. I hope you're having a wonderful morning. It seems to be less wet outside, so I appreciate that. As Dr. Morris stated, my name is Mia Ives-Rublee, and I'm so excited to be a part of the Disability Squeeze Research Symposium. I've worked in many different occupations, from being a vocational counselor to doing research at a university to being a community organizer and political consultant, and then finally being a policy analyst at a Washington, D.C. based think tank. Throughout all of those occupations, I have been able to utilize what I've learned in social work education to advocate for and with disabled people. Part of what that means is trying to solve a complex 3D puzzle while missing a few of the pieces. Research is essential to making policy decisions that actually help communities. It helps fill in the missing pieces of the puzzle. That is why I'm so thankful for the research work being done around disability that is based on social structures and policy impacts versus ableist medical theories that blames the individual's biological, physiological, or psychological traits. Because making policies that help the most people means analyzing how policies impact structures. Unfortunately, right now, we are facing real attacks that will greatly increase the costs placed on marginalized communities, especially the disability community. These attacks are aimed at research institutions, including universities, nonprofit organizations providing advocacy and services, healthcare providers, and local social service providers. At the Center for American Progress, we reviewed the last 6 months of policy decisions and found out that the disability community is facing one of the most deadly crises in the U.S. history. The cost of living as a disabled person is exponentially growing as we've watched Congress/government programs, including taking 7.5 million people from Medicaid rolls, 2.4 million people off of SNAP benefits with the last large bill that they just passed. At the same time, the federal government is removing regulations that reduce barriers and is creating new regulations that strip away people's rights, resources, and supports. Federal agencies are stealing away congressionally allocated funding that was intended to support targeted research and accessible infrastructure development. This will make the disability squeeze even more pronounced and will likely have deadly consequences. The U.S. must reckon with its ableist policies and structures that trap and impoverish disabled people. I've been asked many times why I remain hopeful in this type of environment. Why do I continue to do the fight? And my answer is sitting right here before you. If there are still people out here willing to push for change that will help the most marginalized and vulnerable populations, if there is still a chance to make a difference, if there are still loved ones who need to be advocated with and for, then I still have hope. My hope today is that you all feel the same and that you take what you've learned today back to your agencies, institutions, and organizations and communities to continue to evaluate the structures around you and advocate for policies that free rather than entrap the disability community. I'm so thankful to be here today, and I believe we're going to go into some questions and answers with Dr. Morris.
Mia, thank you so much for that. Wow, very powerful. And we were in DC last week at the new Disability Economic Consortium. The National Academy of Social Insurance created learning about what's happening in DC and learning about the state of research. And I think you encapsulated a lot of that sentiment. So my first question for you today is, we estimate that disabled people spend on average $1 for every $5 they have on their disability-related expenses. What do you view as the biggest disability-related out-of-pocket costs people face in this country?
I think a lot of people would immediately go to healthcare costs, right? That's sort of the immediate thought. And while healthcare costs are a huge proportion of individuals, particularly for individuals who are not on Medicaid or Medicare, I think that we don't think about the other costs, including housing, right? A lot of us spend a lot of money on housing, and to try and be able to find accessible, inclusive housing is extremely difficult for the disability community, who has to often look at newer builds and buildings in order to find anything that looks somewhat accessible. And so I would say I think we are not looking far enough out, which is why I appreciate this research in looking at the costs of disability.
Right. So housing costs skyrocketing across the country for years now. And it's a perfect example of a cost that has risen for everyone, but is even greater for disabled people, trying to find accessible housing, trying to find housing in an urban center that's access to public transportation, modifying homes. These are enormous expenses. I think it's a great example. We'll share a chart later that healthcare related expenses were the most common, right? Prescription drugs. For example, I don't know if you have any what's happening with prescription drug pricing in Medicare.
Yeah. So originally, the previous administration had put out regulations to make it easier for Medicare to be able to negotiate with drug pricers, and starting with the insulin costs. And unfortunately, those are being rolled back, making it much more expensive for individuals. I remember hearing a couple of folks in the community talking about how helpful it was to have those extra dollars in their pocket, because I know individuals who, squirrel away their medication, which it has actually resulted in deaths. Particularly, we've seen this with folks with diabetes, um, and it's really tragic because it is, something that is so easily fixable, and had been somewhat fixed. And for it to be having been rolled back is a tragedy. Yeah.
Yeah, I know medication non-adherence is a more common for disabled people. And this is another good example of a cost that the American consumer on average is experiencing elevated prescription drug pricing or feeling the pinch of, but even greater among disabled people feeling that squeeze in dealing with these really difficult trade-offs, right? Do I cover my food, my housing, my car, or my medicine,
Right.
or my assistive tech, right? And having these just really dark trade-offs that they have to make in making decisions. So I'm curious how you think people really are coping, and what are the short-term and long-term impacts of these kinds of expenses on financial security?
I think we already know that disabled people are less financially secure across the board. Poverty is two times the rate of the general population. And I would not be surprised if it continues to grow in the next few years. We looked at the poverty rates of individuals across the board with the new poverty statistics that just came out, and found that disabled people were one of the few populations that actually saw a growth in poverty in the past year. And the other groups included particularly Black women, Indigenous folks, and surprisingly Asian Americans as well. And so, I think we're going to continue to see that as prices for food and other essential resources are increasing and inflating. We, had started to see a cooling off of inflation prices, but with the current tariffs that are happening and the uncertainty in the markets, we've just seen it grow exponentially again. And so I think for the short term, people are going to go without. They're going to, as you said, make trade-offs for specific things. But I think in the long run, we are going to see people unfortunately be institutionalized, which I think is a real push right now across the political spectrum, I would say, is to put disabled people, particularly those with mental health disabilities, into institutions, and also see a higher death rate and mortality rate amongst individuals with disabilities. So it's not a pretty sight, and I think that is why we need to see more communities pulled together to try to provide supports for vulnerable communities, thinking sort of outside of the box.
Okay, we're going to hear about an excellent example of a community action filling unmet needs later today. One of the other major findings of our study was that disabled people with low incomes report fewer expenses but greater unmet needs. So what does it mean to live without things you need to fully participate? And how does that show up in communities across America?
Yeah, I was talking actually about the housing issues, and there's a lot of individuals with disabilities who live in inaccessible houses, right? Because they can't afford the accessible house that they need, and there was a GAO study that looked at the health impacts of living in inaccessible housing units. And what they found was that there was a significant increase in health issues for individuals who lived in houses with stairs, who lived in houses that had inaccessible kitchens. And so those were significant impacts that we were that I saw in the GAO study, meaning that we are going to see, greater costs in healthcare for those individuals. So in the long run, are they really saving that much money on that? Yeah.
Getting further healthcare costs, really hurting people's health, right? Ultimately damaging health, leading to increased likelihood of mortality, like people dying.
And increasing disability.
Increasing disability. The cost effectiveness argument is not there, is your argument, right?
Yes.
We would be a more cost effective social policy system if we were to prevent and ameliorate. And one thing that comes to mind for me is, I study a lot the United Kingdom, the British system, and in the UK, there is actually a program called the Personal Independence Payment Program, which is a program focused specifically on helping disabled people with their extra cost of living. It comes with no income or earnings requirement, so there's no poverty attachment to it, and we have nothing like it in the U.S. and we have very similar systems. So how people are getting by without and the long-term effects. Maybe you could talk about another really outcome that I think a lot of people are concerned about, which is employment. What is going without things you need? What impact does that have on the ability to get to work?
Yeah, I think that people assume that everybody is healthy and so they can just go to work. And not realizing that if you don't have access to healthcare, whether it's being able to get that knee fixed, being able to get a wheelchair, being able to get various things, it makes it much harder to be able to go in with your full self into employment. And so I think it's extremely bad practice to say that you must be able to work before you're allowed to have healthcare insurance. It's something that we've talked to union organizations, we've talked to many other healthcare institutions, et cetera, really trying to talk about that impact of not having health insurance and how that impacts an individual's ability to work.
So health insurance, access to the goods and services you need are necessary conditions for employment.
Right.
We published a book chapter, Nanette Goodman and I, on this, where we found in our survey an association between disabled people who reported unmet needs were less likely to be working.
Right.
This was it's not a causal, it can go both ways, work and unmet needs. But it does suggest, and I think there's a solid basis in the research literature that advancing access to needed disability-related goods and services would increase employment, right? Having help with your extra cost of disability, it certainly would prevent a poverty trap, right? Where people can't earn, can't work in order to get the benefits that they then need, which would help them to work, right? That catch-22 that we talked about later. Maybe you could talk about another issue that I think needs more attention, which is how do disabled people survive while they're waiting for these benefits? Because the waiting for Social Security, for Medicaid waiver program, that's something we don't have good data on, is literally how are people funding their consumption when they're forced to be poor and they're waiting?
Yeah. I worked with many of these individuals when I was working at Vocational Rehabilitation Services. And it was one of the reasons why I kind of got burnt out, was the fact that I had clients who were living on the streets, who were living in container units without air conditioning. And they were individuals who were surviving basically on the soup kitchens that were around. They didn't have a mailing box. And these individuals knew that they weren't allowed to basically work while they were waiting to see if they could get eligible for disability. And so they were in this real impoverishment trap of not being able to work, not being able to get healthcare insurance, not being able to afford housing, food, or transportation. And, I would sit there trying to get as much money out the door as possible through VR. But it still often wasn't enough. And there were too many times that I would be trying to find a client. They hadn't shown up for an appointment in the last, several months, and come to find out that the individual had passed away. And it's a real experience, and it's hard to go to a lot of these politicians and talk to them about these real experiences that happen on the ground, and them say, well, the individual wasn't working hard enough.
Administrative burdens. I think we should talk about this, right? Which is the hoops that people have to jump through to get their benefits. What are the emerging burdens on your mind that are coming down the pipeline?
Oh, gosh.
I'm
yeah.
thinking about Medicaid eligibility requirements, work requirements, and how do you anticipate that affecting the disability squeeze?
So the OBBA, which was just passed in reconciliation, just required individuals, one, to be able, if they don't quote unquote count as disabled, which basically means the individual is on SSI or SSDI or veteran benefits, then they have to be able to work at least 30 hours for that month, or volunteer for that month. So that's one of the requirements. Unfortunately, most of the social service organizations across the states are not going to be able to track that. And so we've already seen in Georgia was trying to track this. They were not able to keep track of the amount of work that they were doing, that clients were doing. And so it's not only, a burden on the individual, but it's also a cost burden on the government, and which makes no sense. The second thing is that we are going to see a requirement to prove your residency in a specific state. And that is going to be a problem for homeless individuals who don't actually have an address, or individuals who are migrants. So they go from state to state, depending on where they work, depending on the harvest cycle. Those individuals will also have difficulty being able to have a proof of residency. And so, we're going to see, and they're going to have to sort of prove this monthly. And so, I don't see how any social service organization is going to be able to track this. Plus, individuals with disabilities are going to just, even though they are eligible for these services, they are not going to be able to receive it.
Well, we have a lot of state leaders actually joining. We'll have the Chief Disability Officer of the state of New York will be speaking later today. I know on our registration list, a lot of state leaders. And, I really think this is a time for states to be, a lot is falling on state leaders to coordinate. And are you seeing that coordination happening around how do we prepare? How do we implement this in the least harmful way?
I think that we've seen it a little bit. I don't think we've seen enough of it. I would say that I think this is sort of a form 4 alarm fire that states really need to take into account. I know that a lot of legislatures across the country are having to meet again in special sessions because they did not realize that they were going to have to deal with cuts in Medicaid and SNAP, which is going to affect other parts of their budget because most states have to have a balanced budget. And so I know there are calls and meetings of state governors across the country who are trying to develop plans. But it's really, I mean, unfortunately, there's more disabled people in states that are not going to take this seriously, who are not going to provide the services and supports and mutual aid that is needed for those communities because they agree with the policies.
So the Center for American Progress published, I think, a really fantastic timeline of the OBBA, of when things, and most of it passed. I don't know when it passed this summer, but most of the implementation has not begun, right? And we're seeing, so I think do you anticipate this being a major issue in American politics this time next year, OBBA?
I think it's a problem
It's
now.
already now, and
Yeah.
you're already seeing
Yeah.
this. But people aren't really talking about it, I would say.
I would say you go into the medical field, they're talking about it all over the place. We've seen closures of providers. We have seen closures of hospitals already. And so, you know, we're in a piece that we put out a couple of months ago, we talked about hospitals that are already on the verge of closing, most of them in rural areas. And we're going to see massive closures and people not having access to healthcare within an hour of their driving range, which if you know, if you are anywhere near the medical field, a lot of emergencies, including heart attacks, you really need to be able to get to the hospital within 10, 15 minutes of the crisis. And that is going to cause catastrophic issues. So I think a lot of places are buckling down. We're going to see a lot of people losing access to resources. And so, a lot of politicians were talking about, oh, we're going to be worried about this right after the election, the next sort of big election. And I was like, no, we're going to be seeing it now. We need to be addressing these things now.
Another big looming change that I don't think has gotten much attention is the regulatory changes to Social Security disability determination.
Yeah.
Can you explain to the audience this? I just learned about this last week.
Yeah. There is a regulatory change that will likely happen sometime in December, I believe, is where they're planning on, although, the government, they're not always on time. So it may be a little later, but what we're going to be seeing is a change in a couple of different things. One is something that we actually support if it's done right. No promise that it is going to be done right, but basically the codes that are attached to specific types of jobs. Right now, the jobs are really, the codes for the job billings are really out of date, which means that there's certain jobs that are available right now that do not exist in the job codes right now. And there's certain jobs that are currently in there that are no longer available. And the Social Security Administration actually utilizes those codes to say, oh, this individual can or cannot work based on these job availabilities. And so some of these jobs are, extremely archaic jobs, and they're like, oh yeah, this person can do this type of job, this manual job, and it's like, no, this job doesn't actually exist in society. So there's that, and then there's also going to be a change in how much a person is able to work based on stating that this is enough work to be sufficient for an individual to live. And so, and what is going to happen is they're going to decrease the amount of hours that is going to be sufficient for an individual to be seen as sufficiently employed.
Via regulatory changes. I thought that would require congressional action, but they're doing it through the regulatory. This is a legal. I know we have lawyers in the building. I'd love to hear your thoughts on this later. That's an enormous change. And at the same time, I think there's an increase of funding for continuing disability reviews for existing beneficiaries, meaning increased reviews of disability.
Yes.
We were talking last night about the precedent of 1983, I believe, the Reagan administration, also greatly expanding continuing disability reviews. and the need to really resurrect this history, this was a nightmare, where you had lots of people losing their benefits overnight. There was suicides, people, devastated in real horror about what happened. And, I think we need to really bring attention to what these mean to have, I think, a surge of continuing disability reviews for existing claimants as well. I hope people are bringing attention to that. And so we have about 5 minutes left, and I don't know. Yep, our next speaker is here. That's great. Should we move?
One more question?
So one more question. Okay, here's my grand vision. Let's end on a positive note. What would a society look like where disabled people no longer face extra costs just to participate?
I think that one, we don't attribute a person's worth on the basis of them working. I think that is a basic fundamental shift that we need to have, because that is the fundamental part of why we see the policies we see right now. I think one of the big things that we need to start doing is planning for an aging community that can help us bolster some of the accommodations and accessibility that we need to see in society. And I think that will help sort of future-proof ourselves with a continuing disabling sort of society. So I think there's a lot of things that we can do, but I think the number one thing that we do need to do is look at really trying to change our mindset on individual worth and not being attached to employment.
Thank you, Mia.
Yeah,
What a
thank
pleasure.
you.
Thank you all so much for listening.
Thank you.